BC has joined with the federal government and First Nation leaders to establish a tripartite First Nations health agreement to close the gaps. In support of this, each First Nations is developing a comprehensive health plan that will be a foundational document for the design of community health services and the creation of working partnerships with governments and health service providers. The Syilx Health Plan is based on priorities identified by each of the 7 bands and consulted by the ONA Wellness Committee. The plan stresses that it is important to acknowledge the impact of social determinants of health, such as employment, poverty, housing, and education. One thing that healthcare professionals need to be aware of is that there are traditional medicines that have been effectively utilized for our people for thousands of years, and some people are still using those traditional medicines today. If you are concerned about how a traditional treatment may interact with mainstream medicine, then it is your responsibility to explain fully why you are concerned. Our nation is moving to take greater control of healthcare services and to encourage members to see healthcare as a personal and community responsibility. The community health nurse and the Aboriginal Patient Navigator both help Syilx people effectively access healthcare they need. Being aware of these resources and encouraging your Aboriginal clients to use them will make your work easier and facilitate better outcomes for your healthcare recipients. The community health nurse, called CHN or the band nurse, works on reserve and is often the first person in a community that members will contact when they have a health concern. The CHN has a range of duties that promotes wellness, including immunization, pre- and postnatal programs, and supporting elders, those with chronic illness and disabilities, and also responds to the health concerns of community members by helping them access relevant mainstream healthcare services, and then providing ongoing monitoring to ensure the implementation of programs targeted to their particular needs. The second resource, Aboriginal Patient Navigators, was introduced more recently. APNs are a key part of helping the services get traction on the ground. They link Aboriginal patients with IH services and are a timely bridge. 7 APNs are located throughout the IH region, and APNs collaborate with and assist healthcare providers in early identification and assessment of patient needs. They also participate in the discharge planning process to ensure appropriate patient aftercare. APNs can support Aboriginal people to find and use mainstream health services as soon as the need is identified. APNs act as a resource to ensure care is culturally safe. They advocate for respectful communication, facilitate traditional practices, and can present training on cultural safety. As well, explain how the traditional medicine might counteract the effects of the mainstream medicine. Health is a partnership. A practical step that you can take is to meet with your APN in your region, and then encourage your Aboriginal clients to do the same.